Hello, everyone. Thank you for jumping on our Zoom today. We're just going to be waiting a few more minutes for others to join, but we should be getting started right about 6:02, 6:03. I know there's some people getting off work, finishing up on clients, so we'll just wait a couple minutes and then we'll get started.
Also, just from my point of view, Sarah, it's Dr. Tom speaking here, that it's 8 a.m. in Australia, so some may not have woken up yet.
Ah, here we go.
Good morning, Tom. It's evening my time and afternoon in Sarah's time. We welcome everyone to this webinar. We've built a lot of traction and a lot of interest in our technology, Juvasonic, and partnering with other companies, physicians like you, Dr. Tom. It's a pleasure to have you today.
Thank you, Sanjay. It's a pleasure to be here.
Yeah.
All right, so one more minute and then we'll get started. Do you have your coffee, Dr. Tom? How do you like
I'm
your
not a drinker, believe it or not, Sarah. I'm actually a tea drinker, but no, I don't have either today.
Ah,
And
me?
I should be a coffee drinker. The blue zones, you've heard the story about the blue zones, and the best coffee is actually Greek coffee or Turkish coffee, those grinds. It's supposed to make you live longer. Talking about regenerative medicine longevity, that's something that I don't know if you're familiar with the blue zones. There's four areas in the world that has the most centenarians, and they had one thing in common apart from other things. One of them was this Turkish coffee. These Greek Turkish coffee was one thing that they all drank, believe it or not.
Amazing. I love Turkish coffee. The cardamom, it's just perfect.
Yeah, I'm not a big fan, unfortunately, and I'm Greek.
and Tom, you know me well enough to know what I will have in my hand in about an hour
Absolutely.
from now.
And I love that about you, Sanjay. I actually love that. It's very, very, it's your trademark, my friend.
Yeah, yeah. In fact, Aaron Crowley from Brasilia, a technology we'll talk about today, made a joke about tequila, and I went Blanco, Reposado, Anejo, and we'll create a Sanjeo. I thought that was pretty funny. So, Sarah, I think we should get started before I get off topic.
Okay. Okay, well, welcome everyone. Thank you for joining this evening. Good morning to everyone in Australia. Good afternoon to everyone on the West Coast, and good evening to everyone on the East Coast. Please help me welcome Dr. Sanjay Batra, who is the creator, CEO of Juvasonic. And we also have Dr. Tom Parmakellis from Australia, who is the owner of Look Fresh Cosmetics. And let's go ahead and get started. Oh, one thing I wanted to remind you all, we actually have a Q&A up. So during the call, if you have any questions that come up, go ahead and click on the little box at the bottom. And towards the end, we'll try to get through all of your questions. Also, if you have registered today, you absolutely have a chance at winning a free Juvasonic device. We're going to be announcing a winner from Australia and also one from here in the US. So you gotta stick to the end in order to receive your prize. So okay, let's go ahead and get started.
So, maybe, Dr. Tom, with your permission, I'll start with just a couple of introductory comments. We launched Juvasonic in the United States a little over a year ago. In fact, it was April of 2025. And relatively early on, Dr. Tom contacted us, and we were very impressed that our product had made waves all the way down under. And we didn't really know what to do. We were very focused on the US market. But Tom, you made it very easy to partner with. I have to say, I appreciate your dedication, your interest in science, also your business acumen, creating a fair agreement. Dr. Tom is the distributor of Juvasonic in Australia and New Zealand. He's pioneering this technology in that part of the world. And it's great to have you here today. Dr. Tom has an amazing presentation just showing his commitment to advancing the science. And maybe without any further ado, we'll hand it over to you, Dr. Tom. And before you go through your data, which is late breaking and very exciting, maybe you could take a moment and tell us about yourself and how you got involved in aesthetics and in particular in regenerative aesthetics.
Thank you, Sanjay. As I said, pleasure to be here and pleasure to have combined and partnered with you with the Juvasonic. I am originally a GP in Australia. I graduated in 1992, which is a long time ago now. And when I first graduated, I was an intern at the Prince of Wales Hospital in Sydney. And one of my senior consultants had basically brought the very first laser tattoo removal laser into Australia. He was the first one to start this. He was actually a geriatrician, not a plastic surgeon, which was a bit interesting, but he'd brought the technology over from the UK. And he asked me to work in that clinic for him. So the first experience I had with anything cosmetic was removing tattoos from patients with the Q-switched ruby laser. That was my first foray into the aesthetic field, and I actually really enjoyed that, and I thought this was a good business to be involved in. So I continued to do my hospital training for the further 33 years. I then went off and did my fellowship in the Royal Australian College of GPs, and while I was doing that, I read an article about laser hair removal using the ruby laser, but in the long pulsed mode. And so I got very excited about this, having used the ruby laser before. And I basically went over to the UK and signed up a deal with a company called Lambda Photometric in the UK, and brought the first ruby laser out to Australia and started the first laser hair removal clinic. So we were one of the first people to bring laser hair removal to Australia. And then, I continued in cosmetic practice and learned how to do other treatments and fillers and then Botox and all those other things that we do in the cosmetic field, and have stayed in the field since then. And I love this space. Having been the first one to bring laser hair removal into Australia, also, I was very excited when I saw the Juvasonic, and I wanted to be the first one to bring that into Australia. And it's happened. So I'm very grateful to you, Sanjay, for that.
Yeah, thank you, Tom. So please share your presentation. This is late breaking work from Dr. Tom. After his presentation, I believe you have a couple of videos you'll also be sharing. So we look forward
Sure.
to the presentation. Thank you.
Sure. This presentation is simply, I wanted to see how good the Juvasonic was at delivering different serums into the skin. And I chose initially the exosomes from the States, from the Resilio Regeneral company in the US with its the Crowley Center. And the reason why I chose those is because in my research, I wanted to find something that, hopefully would be effective. And there's a lot of hype and a lot of misinformation about exosomes. And these exosomes were human derived from the umbilical cord. They were frozen, not lyophilized. And I thought it made sense that these would be something that I would like to use. And then partnering that with a Juvasonic device to see, are we able to deliver something that I hope will make a difference? And so this study shows the actual products we used. We wanted to compare the Juvasonic device with a microneedling device using these age 0 exosomes. So we picked Dr. Penn because that's the one we use in our practice, and simply we wanted to compare. So we had 3 groups in our study. The first group, we used the Juvasonic device to deliver the exosomes. The second group, we used the Dr. Penn microneedling device. And the third group, we decided, let's see if we may get even better results if we follow the Juvasonic on with the microneedling. So they were our 3 groups. The treatment protocol was as follows. We enrolled patients from our clinic. We have over 6,000 patients in our clinic, and we sent out an email, and lots of people responded, and we picked the first 30 or so patients. They all had their first treatment at day 0. We used the 10 billion number of exosomes of the age 0 exosomes. And so day 0, they had photos taken, they had their first treatment. 4 weeks later, they had their second treatment. 4 weeks after that, they had their third treatment. So in the space of 8 weeks, they had their 3 treatments, 0, 4, and 8 weeks. And then they came back a month later to have photographs taken. This was done with the Juvasonic, with microneedling, and then with the combination. So what we were trying to evaluate is, cosmetic improvement in both males and females with male and female pattern hair loss using these human-derived exosomes. And we were comparing microneedling with the Juvasonic. We wanted to see if we could see a difference in hair density and thickness, and just if patients were happy with the results. So I'm going to play a little video now, which just simply explains my simple interpretation of the Juvasonic and what we were doing with it. The Juvasonic device is a vibrational device without heat, without needles. It delivers serums into the skin by vibrating at 8,800 revs per minute. It has a consumable, which is a glass sterile vial in which you place the serum of your choice that you want delivered. The glass vial has a plastic cap, and that cap has a microdermabrasion plate. That microdermabrasion plate is what causes temporary disruption to the stratum corneum, allowing the serum to be delivered into the skin with enhanced absorption to the vibrational motion of the device. So when you switch the vibrational device on, it actually vibrates it up to 8,800 revs per minute and allows that serum to be enhanced in its absorption into the skin. That's how this system delivers serums. And this is just me demonstrating. This is my son's head, and we're just using the Juvasonic device in the Juvasonic. Okay, so just wanted to point out there, it sounded like the Juvasonic device was really, really loud. It's nowhere near as loud as that. It was right up next to the microphone, so it sounds a lot louder than that. So this next image that I'm showing here, this is courtesy of Sanjay, Dr. Sanjay Batra, the inventor of the Juvasonic. These are magnified images of the scalp under ultrasound. And if you look at the image on the far left, you'll see there's this double layer of sort of white yellow lines. That actually is the stratum corneum. The next image on the right just shows that when the Juvasonic device has been used with the microdermabrasion plate, you see that that stratum corneum is no longer intact. It's been disrupted. And then you'll see that once you've done that, it takes 2 to 3 minutes to achieve. Once you've done that with the Juvasonic and you do nothing after that, within 15 minutes, the stratum corneum is completely recovered. So I love this treatment for 2 reasons, because you're getting this disruption of the stratum corneum, which is then allowing you to get that serum into the skin. But 15 minutes later, the actual skin barrier is completely resolved, which means that person has their skin barrier is back to normal, which is lovely because you don't have this long-term issue afterwards with maybe applying other products. So this is another image that Sanjay has kindly given us to show you. It shows that this is the skin of the tear trough area, and the baseline again shows this double sort of white line at the very top of the image on the baseline. That again is the stratum corneum, and then it shows where that area has been treated with microneedling device, and then where it's been treated with Juvasonic. If you look at the microneedling image, you'll see that the stratum corneum still seems to be intact, but you'll see these little linear vertical columns of hypoechoic area where the needles have gone through and allowed some of the serum to get in there. So that's the darker areas. It shows that it's done intermittently, but the stratum corneum still seems to be mainly intact. When you look at the Juvasonic image beneath that, you'll see that the stratum corneum here now is disrupted. And if you look at the area that's been shaded in red or outlined in red, it shows a darker hypoechoic area. Again, that's just the serum that's been delivered. These were a brand of exosomes that Sanjay used, just showing that the serum has been delivered more uniformly throughout the skin with the Juvasonic device. So these are lovely images showing what's actually happening, the science behind the device. Okay, so our study, so far, we have 14 patients who were treated with the Juvasonic and the exosomes we talked about earlier. 11 patients were treated with microneedling, and then we treated 6 patients where we used the Juvasonic device initially to deliver the exosomes, and immediately followed by the Dr. Pen. Now, I said to you we're using 10 billion exosomes. So in this case, we used 5 billion with the Juvasonic and 5 billion with Dr. Pen, whereas the previous ones, they've all had 10 billion exosomes, but that was split up into 2 to make sure that we're not using more exosomes in one group than the other. Now, I'm just going to show you 5 of the good photos out of those 14 with the Juvasonic treatment group, and I'll do the same with the microneedling group. So this is patient number 1, and you can see there's a nice increase in the hair density to the vertex of this patient who had 3 treatments of the exosomes with the Juvasonic. Then another patient here, this is a female who's in her 30s, and just showing the temporal area, that's her brow at the corner there in the bottom of the picture, so just to get you orientated. So you can see a nice improvement in the hair density in that temporal area. This next one is the 3rd patient we show. She had a really lovely result. This lady is a model in Australia, and she was very distraught by losing her hair. And we treated her. She came from a fair distance away to our clinic when she heard we were doing this trial. And you can see quite nice improvement in the hair density in both right and left sides of her temporal area. The next patient, again, this is another patient in our practice who you can see that the hair density there is increased next to those 2 moles in a linear fashion there. and the hairline seems to have come a little bit forward. Okay, so the Juvasonic patients. And this is the fifth patient that I'm showing you. Again, just showing a really nice increase in the hair density of this fellow, who again had 3 treatments with a Juvasonic device delivering those exosomes. The next 5 are the microneedling arm. I'm going to show you 5 pictures here. So this is the first one. This is actually one of my cosmetic nurse's mum. She's an Asian woman who was thinning out and was very, very embarrassed to leave her home. She had 3 treatments again, and you can see quite nice increasing hair density to the vertex and the frontal area there. She was extremely happy with her results. The next patient is a gentleman in his 60s, and again, with microneedling, delivering the exosomes. Again, he's had a nice improvement in the hair density to his vertex there. This is a woman in her 30s who, had quite a lot of hair loss centrally in her hair part, and she's had a really nice improvement in the hair density, again, using microneedling with the exosomes. And then our final patient in the microneedling group that I'm highlighting today, she had patches of hair loss. I mean, it's probably alopecia areata, but I can assure you under these images, under that hair is completely grown. It's not covered by hair. She's had a really remarkable result, again, using microneedling with the age 0 exosome. So there are our 5 patients with the microneedling. Then we go on to this is the 5th patient, apologies. Again, a fellow who had a nice reduction in the bald spot on his scalp. A really nice result there. Again, microneedling with three treatments. Okay, the combination treatment group, we only had 6 patients in this so far, where we were using Juvasonic followed by microneedling. And we saw a really nice result with these 2 patients. This patient had a nice improvement in the hair part there with increased density to her scalp. And this fellow here had a nice improvement to his frontal area with his hair. So these are the combination patients. And then I've put a little summary of what we found in these 31 patients so far. So essentially, the way that we graded them, we have 6 members of our team. All of them were blinded, didn't see the other people's scores, and we essentially scored them from 0 to 4. 0 was where we felt that their hair density had worsened. 1 was where there was no improvement whatsoever. 2 was where there was minimal improvement or minor improvement. 3 was moderate improvement. 4 was marked improvement. And we all graded these 31 patients. And when we looked at all the actual grades there, we found that essentially, if you look at the responder rate, we're calling responder rate the moderate to marked, but if you include the minimal improvement, so anyone who's had any increase in hair density, you've got roughly about an 85% number of patients in the Juvasonic group who've had minimal to moderate marked improvement, and almost 60% who've had a moderate to marked improvement with their hair loss. In the microneedling group, you see very similar results again. If you combine the minimal percentage of 27.3% with the 54.5%, you're getting 82% of patients roughly who had some improvement in hair loss. Again, only 2 patients had no improvement. So roughly under 15% to 20% of patients had no improvement. Why that's the case, I don't know. Combination treatment, you can see here we only had a very small amount of patients in the combination group. There's only 6 patients. But we had a similar improvement. 50% of patients had a moderate to marked improvement, and 50% had no improvement. But again, it's a small cohort, so it's difficult to tell if that's true. You would expect the combination treatment to be the same or better, perhaps. So that's my thoughts on that. Then what we did is we did this for the first 3 months, and then we followed up patients out to 6 months. And now we're starting to follow up all our previous patients for even longer. And we did this because we had one of our patients who came in, and I'll show you him shortly, who had the 3 treatments at 3 months. And then he came back at 6 months, very excited to show us that he'd had even further hair growth, despite the fact that he'd had no further treatment. And there were also some patients who were very keen to have more treatment. And so I'm showing some of these results now following here. So the first one here this is the fellow who came to see us with the photo on the far right saying, "I can't believe it, my hair's growing even more." And you can see an even reduced area to his scalp vertex. He was very happy with his results, the fact that he had no further treatment. And he was one of the microneedling patients. The next patient is another patient who at the 3-month stage had an improvement in their hair to the vertex, but then he sent us this photo at the 6-month stage. He'd had no further treatment and he'd had no other products used, and this was with the Juvasonic alone. and you can see, although the lighting's slightly different, the coloring is different, there definitely is an improvement there. He was quite amazed that his hair was continuing to get thicker and grow more. And then the last patient, this is a patient that I know very well. He's actually been seeing me for years for lots of different cosmetic procedures. And at the 3 month, the middle photo is 3 months after the first one. And we initially classified him as being a non-responder. We didn't really feel there was any difference. But then he was so keen to continue with treatment. He had another 3 treatments. And then you see him now at 6 months, and he's had a very, very good result. He actually came back telling us that his hairdresser was telling him how amazing his hair growth was at the back because he can't see this area. And so he is now continuing on with further treatments. But you can see that this sort of indicates the more treatments you have, the better the results may be. And also that having no further treatments, you may still get some more hair growth. So our conclusion so far, and it's very, very early findings, is that, human-derived exosomes, or this brand of exosomes, has definitely improved scalp hair density in a clinically satisfactory manner. There were high patient satisfaction. The patient satisfaction questionnaires we did showed 80% of our patients were satisfied with their improvement. The highest satisfaction rate was actually amongst the Juvasonic group. Now, what I mean about that is they were very happy with the actual treatment results, but even more happy that the fact that there was no pain, there was no downtime whatsoever, and the treatment was very comfortable. In actual fact, many said it was quite pleasant having the Juvasonic device treating their scalp. So my little summary here is that, look, both microneedling and Juvasonic produce positive outcomes when combined with these age 0 exosomes. And a little note about the regulatory stuff, like there's a lot of regulatory information and misinformation going on in the world about these exosomes, but these were basically applied topically. We didn't inject any of them. As you saw, they were Juvasonic or microneedling absorbed. And this presentation reflects, an observational cosmetic outcomes from my ongoing clinical experience. We definitely need further controlled studies to evaluate reproducibility and long-term outcomes. So that's my initial study in-house in a nutshell, okay? Now, I've got some videos here that I'd like to show too, but I'd like Sanjay to jump in if he wants to ask any questions before I show the next thing that I've been very, very impressed with using the Juvasonic device, and that's in how I treat my filler patients now.
And real quick, we did have a question come up from Dr. Dean Visnes, and he wants to know if any of the patients in any of the 3 groups were on any other topicals for home care or also oral supplements for hair growth.
Yeah, very, very important. All of those patients were taking nothing else, not even topical minoxidil. There was one patient who I didn't show you his results. That patient was taking everything under the sun, minoxidil, DHT inhibitors, supplements. He was taking everything. So he was the only patient that, was actually doing other things. All these patients that I've shown you now were taking nothing at all. We actually made sure that they weren't on any other products. We allowed that one patient who was doing all those other things because he was adamant he wasn't going to stop any of them.
Amazing. And one more question regarding the microneedling. Andrew Johnson asks, what was the depth of the microneedle used? And was there a difference in the ages of the patients in the groups, as younger patients may respond better to treatment?
Yeah, very good question. We have got the age breakdown, but the first thing to say is the microneedling we did, which I was very surprised with, was a very low depth. It was only 0.5 millimeters. We were essentially trying to break the top layer of the skin to allow the serum to get in. We didn't want to go too deep. And over my experience over the last few years, when we first started with microneedling, we would be very aggressive with, facial microneedling to 2.5 millimeters. We found that actually can cause some problems. We now use very, very superficial depths with microneedling. And when it comes to serum delivery, I don't think you need to go any further than 0.5 millimeter. We're even contemplating using 0.25 millimeters because the stratum corneum is very, very thin. As far as the age group, sorry, Sarah, I can't really give you figures on that. We have got figures, but basically I agree with what the thought process there is, that if you're doing microneedling, younger groups should get a better result if you're talking about neoangiogenesis. But my feeling here is that we're not really doing much here with the microneedling from that point of view with the hair. The hero here is the age 0 exosome. So regardless of whether you do, younger or older people, I think the results are going to be, it depends on how they respond to the exosomes rather than the actual microneedling itself. That's my thought, to be honest with you.
Great.
So, Tom, I'm very encouraged by these data, and I'm very encouraged that Juvasonic and microneedling were both effective given the small sample size. It's very encouraging. And I think what you just said is a key point is that the exosome product has to get to the base of the hair follicle in order to
Mhm.
stimulate hair growth, increases in density, and moving the follicle into anagen phase. And it really doesn't seem to matter so much, at least based upon these preliminary data, how it gets there, whether it's through microdermabrasion and vibration with Juvasonic or microneedling. Would you tend to agree with that comment?
Sanjay, I definitely agree with that comment. But my thing that even encourages me more so is not only the fact that either method works well, but the fact is that um, Juvasonic does not hurt at all, and people actually enjoy the experience. So, from a patient experience point of view, we have an advantage with the Juvasonic over microneedling because of that particular fact that patients come in and feel like they haven't had anything done, and then to see these results, they're amazed. As I was, to be honest with you, Sanjay, at the beginning, I really felt, if you're just doing a very minor microdermabrasion, how are you getting this stuff in? The photos that you've shown, the images you've shown, made me feel more confident. And now, having done this study, I'm extremely confident that both these methods work. But if I was going to have the treatment, I'd much rather prefer to have the Juvasonic on my scalp than a microneedling device.
Yeah, and I think your work is very prescient, meaning in the future, microneedling may be done at a lower depth of needle because the deeper the needle, you create pinpoint bleeding, you have a coagulation event, you have blood going in the opposite direction of where you're trying to deliver, and there's inflammation. Inflammation is the enemy of hair growth. So I think your work is very prescient in that it's really the stratum corneum that you want to disrupt, and you don't need to go very deep in order to do so.
Yeah, in actual fact, Sanjay, you're spot on there with what I'm seeing. I actually, to be honest with you, I expected to see better results with the Juvasonic because my feeling was when you do microneedle someone, you are actually causing that coagulation cascade. And so I actually felt that you probably wouldn't get very good serum control, serum delivery, sorry. So I think perhaps maybe that what my thought process is there is that because we've only gone zero point 0.5 millimeters, I think that's why the outcomes were pretty good. I think maybe if we went deeper, maybe we would have had not as good as an outcome. That's just a presumption from me. I'm not really sure if that's the case. But the nice thing to say here is that both systems work.
Yeah, yeah. Thank you very much. Sarah, are there any other questions? And if not at this time, I think, Tom, you can go ahead and share the videos.
I
Yeah.
certainly would.
Yeah.
So I want to show you. So what I've been quite interested in, very excited about, is that when you brought out. So just for the audience there, if you look at those images that you can see on the screen there, the third image shows me holding the Juvasonic device, and you can see a smooth metallic plate on the end of the cartridge. When Sanjay brought that out, I wasn't sure why you guys were bringing that out because my feeling was we need microdermabrasion. So why have we got this flat plate? Um, and I think that when I spoke to you, you told me that what you were effectively doing in areas which might be a little bit sensitive, like under the eyes, you could still, apply this to try and get serum in. But I felt we need the microdermabrasion. So I thought this is not silly, but I thought I didn't really see a use for it. But then I saw your presentation on the radius nodules where you used the microdermabrasion plate and it flattened out that nodule quite quickly afterwards. And I actually got quite excited because I do a lot of filling where I fill lines, and especially I've got a lot of patients over the years, and they've come to me from other clinics where they're actually Botox resistant or botulinum toxin resistant because they have had too many treatments or too many treatments close together. And so they don't actually get any benefit from having Botox. And so a lot of the forehead lines, as you can see in some of these images, there's not a lot you can do. But I'm a big fan, and I've been doing this for a long time, and I know they're high risk areas, but I actually inject hyaluronic acid, cross-linked hyaluronic acid fillers into these lines in the forehead. And often we get quite a lot of ridging. And I told patients, look, you just have to put up with 2 weeks of quite a lot of lumpiness and looking like you've got track marks across your forehead. And those patients who do this treatment get a bit annoyed, of course, and no one wants to have that downtime. So I thought, what if we use this method with the Juvasonic device with the flat metallic plate and see if it can actually flatten down these fillers? And so I started doing that, and I was very encouraged, and I saw every patient I used this device on, when I was doing this particular blanching technique, all of them had the filler flatten out to some extent. And I thought, wow, this is a great little tool to have just by my side every time I'm doing these fillers. So I'm going to show you one of those videos right now, and hopefully this one works. So I'm going to play this.
And Dr. Tom, we can't hear the audio. Do you want to explain what
Oh,
you're doing here?
I apologize. Okay, I'll just look at now. Essentially, what I'm using a to balance here, which is a cross Italian of a smaller grade, and I'm essentially just putting little tiny plants over this whole area, which has lots of lines, a lot of crepey skin, okay, and they get lumps like this. Okay, now this is the part that people don't appreciate, don't like, but as time goes on, they go down. They can take a couple of weeks to go away. So what I've done here is I've got the Juvasonic device. After I've treated her whole face around her mouth and her chin and her lateral marionette areas, I've put on the flat uh, Juvasonic cartridge applicator there. See that, and I'm basically going then to use that to flatten down one half of her face, so her left side. So I'm essentially just showing you there in that video that that's the flat cartridge, that what we call the smooth nano cartridge. And you don't need to put anything in there. Sometimes I'll actually put some saline in the cartridge just to have it as a glide. But in this case, what I did was I got a little bit of chlorhexidine after I did these fillers on my fingertip there, and I basically rub that into that right side, which is what I'm doing there. And then I've gone and I've used the maximum speed, which is this. The device has 3 speeds. Maximum speed is 8,800 revs. And initially I put it without the collar, and then I put the collar on because it's a little bit sturdier for me to do this. So you can see that I've just got the plate there. I'm rubbing it back and forward. This was literally done for 2 to 3 minutes. It wasn't long at all. And she was, I said, success rate of 100%. Every single patient I've used on, the fillers flattened out quite reasonably. And you can see here in the video, there's a nice marked improvement from her left side compared to her right side. Much, much better to walk out of my surgery with that the lumps and bumps that we used to get. So I was really impressed with it. I was very, very happy with it. And it's a nice way to actually dampen down these fillers where they're superficial. So if anyone does this sort of treatment, this is a nice way to dampen them down. Patient was very, very impressed.
That's very impressive, Dr. Tom.
Okay,
I might
so
say that
I'm going to see if I can show you another video.
Sorry, Tom, as you're speaking and the video is playing, we're having a little bit of a bandwidth issue. So maybe
let me know if you can see this, and I'll talk you through this one too if you can't. So I'm going to play this. Can you guys all see that?
Yes, we could see it. However, when you talk when the video is on, it does cut in and out a little bit.
Yeah.
Like I've lost you guys.
We see.
It's my audio, isn't it? Sorry, guys. My apologies.
There's a bandwidth issue, Sarah. If we can.
Sorry, it's playing like this in the background. Yes.
There we go. Good.
That's the wrong one. Let me close that one. This is the one I want to play. Can you guys see this one?
Yes.
Yes?
Yes.
Yeah, okay. So I'm going to play this one now. I'll talk this. Can you hear this one? Sorry, can you hear this one?
We cannot, but it's okay if you want to explain afterward.
I'll talk over it again. Yep, I'll talk over it again. So this is Jackie. This is my receptionist. She's one of 6 patients in my practice who are Botox resistant. And so none of the botulinum toxins work. So I'm doing the same thing here. This is a bit more of a high-risk area. I'm actually doing very, very superficial placement of this hyaluronic acid cross-link product. Again, a very light one. You can see all those ridges there. I'm showing you what she looks like immediately after I've done that. And, you know, again, when we would finish, they would walk out looking like this, which again is undesirable if we can improve it. So her right side has had no treatment. Her left side has had me using the blanching technique where I've gone along those lines to reinforce those lines. And you'll see when she actually raises her head later, her forehead, her eyebrows, you'll see the difference it makes immediately. I'm now just showing the Juvasonic device again and how we are going to use the cartridge, the smooth cartridge, um, and just really just to dampen that down again, just to flatten those fillers out. Now that's the microdermabrasion plate. You can't really see, it's not in focus there, but we're not using that. It'd be silly to use that, to be honest with you. You shouldn't use that, in my opinion, because then you're breaking the stratum corneum. You've just put fillers under the skin. You don't want to be making it more likely for them to get an infection. And if you take the stratum corneum, you've got 15 minutes of the barrier being broken and perhaps getting infection. So use the smooth one when you're doing this technique. They are sterile cartridges, so you're not going to increase your risk of getting infection there. And perhaps just place some chlorhexidine or an antiseptic of your choice over the skin before you start doing the treatment. But again, we're just vibrationally using the flat nano cartridge to dampen down that filler projection. And here I'm showing I'm putting some saline into the cartridge because I'm going to use this as the glide. So once I put the actual adjustable, the plastic cap with the smooth metallic plate, I'm opening that up just to get a little bit of fluid coming out. And it's adjustable. These cartridges are adjustable. You can't really see it on screen there, but you can turn it a quarter of a turn from being closed off so no fluid comes out to fully open so the fluid pours out quickly, again depending on the viscosity of your fluid. So once I've done that, I've changed over with the flat part, and we're just going over Jackie's left hand side, which is where I did the fillers. And then you can see here where the left side's been done. It looks much nicer. It's not as lumpy as it was. There's still a little bit of lumps and few ridges, but nowhere near as much as when I'd completely finished. And we can spend more time. That's just after 2 minutes. You can spend more time flattening that out further. You can delegate that to your dermal therapist. It's not a serious treatment. Anyone can do that for you. And when you see her now raising her brows, you can see how her left side does not have the furrowing and the corrugation that she does on the right side. And that's purely because of the filler effect. There's a little bit of swelling, etc. But we do this with her every few months, usually twice a year, and she gets a great result. Now, I'm also showing on this side, I'm doing her right side now, and I'll show you again when we've done that. We do a little bit of, I continue to sort of flatten down that left side. I wanted to really highlight the difference between the left and the right. And you can see here, again, this is the video from earlier. We'll go back to using the Juvasonic device. So I'm still using more of it on the left side. The right side, you can see the ridges. We haven't touched that with the Juvasonic. That's the side of view. And you can see the difference there. It's quite lumpy there compared to the other side, which is flattened out considerably. The redness, once that goes, it won't look as obvious as it does right there. So you can see that sort of track marking, but not lumpiness. And that's a really beautiful way of doing that. I found this, for me, is a really nice addition to my practice, because this is something that I do a lot of. And if you see there, the question was asked in the captions, what other areas can you do? I've used this, and I love using this now for lip lines and for accordion lines. Smoker's lines, lip lines, you see with a lot of patients where, as we get older, losing elasticity, there's not a lot you can do there. You can, even with a ablative laser, sometimes you don't get great results there. So I've started using my blanching technique and then going over the top of it with Juvasonic. And if we have time later, I'll show you one patient who I did that recently, who's had some beautiful results, and there's no ridging. There usually would be ridging when she left, again, without using the Juvasonic device. So I've been very happy with that. So yeah, very, very nice new application. And I think this will be a transition into us talking about another application, which I believe will be fantastic for this device. So I'm going to come out of that. I'm just going to talk to you guys about that as well. So let's minimize this. Let me get back into our meeting with you guys.
Wow,
And
this is absolutely incredible. And I was so excited to see that, we are a cosmetic use device, but to see this used post protocol to help reduce the appearance of these filler nodules is absolutely incredible. It's going to be a solution for so many, of the reason why most people avoid getting fillers to begin with. It's
I
amazing.
just think it's a fantastic. It's such a simple device, Sanjay. I When I saw that, I went, "This is like, why are we putting a flat, smooth surface on it?" But you know what, Sanjay? I do a lot of renovations around. I love renovating. I think that's why I love my cosmetic practice so much, because I feel like I'm renovating faces rather than homes. But I now compare this. I sort of said jackhammer. Jackhammer is not a really nice term to use on this, but even I've done where I've put down road base and got my compactor and make that nice and level. I feel it's like a very gentle compactor over the filler and makes a really nice result. So it's another application which really came from you, Sanjay, when you used it on the radius nodule. I thought, let's try this now that we've got the smooth applicator, and I was very, very impressed with it. I was very happy with it actually, and it's now part of my daily use. It sits next to me. I use it. I don't even get my dermal therapist to come out and do that because it takes time for me to call her in to take the patient out, do it. It takes me 2 minutes. I just grab the Juvasonic device. I just go over the skin, over those areas, and I use it. And this is where maybe a little segue onto what I think will be fantastic use of the device in this way. I don't think I've spoken to you about it, but I'm going to mention something unless you want to ask me something first.
Well, Tom, maybe I'll just say that when we launched the flat tip, you're right. People were wondering why we did that in the realization that it wouldn't have the dermabrasion. Well, we did it to apply post-procedure on compromised skin in intimate areas. And we have another application, which I'll talk about when you're done. But I'm grateful you found a very practical use for this and the way that you showed it in the video. So very, very impressive.
Thank you, Sanjay. Yeah, now it makes sense what you just said. Post procedures, absolutely. You don't want to using microdermabrasion. The same thing that I said earlier about using the microdermabrasion plate over the filler area. You don't want to increase any more bacterial contamination there. So that makes total sense. Okay, this is what I've been thinking about lately. I haven't started this, but I think this is going to be a very good addition with the Juvasonic. So a lot of us now are getting more into the regenerative space. People don't want to have fillers and overfilled faces and frozen faces. And many people are now starting to turn more to the biostimulators, things such as PLLA and PDLLA, and which is Sculptra and even Radius and Juvalook or Lenizna. So they're the three brands that I'm familiar with. And what happens with these products is they need to be shaken up very, very well. Otherwise, they sediment. They come down and they sediment. So you're supposed to mix these things before you inject them into people's faces. And these are the stimulators which are, essentially they're put in with cannulas under the skin, Sculptra, full face, Lanizna, different areas of the face. And these PLLA products and PDLLA products, what the biggest complication with these products is lumpiness and clumpiness of these products. Now, I just went, why on earth would we not do this treatment? You may not be the best injector. Obviously, if you're a very good injector and you're spreading these products evenly, you'll get a nice result and less chance of clumpiness. And especially if you're shaking the product before you inject it well and making sure it doesn't sediment. But if you did inject this and then went over the entire face with the Juvasonic with the flat, smooth one, you're going to get very uniform spread of these products in that area. You're going to get a better improvement in the collagen stimulation. You're going to get a better result. I think this is one area where everyone who does these biostimulators will be getting better results, more even distribution of the product by using the Juvasonic device with the smooth nanotip. So I see a huge area there, and we're going to start doing that with patients that we are under eye area. We're going to start doing a lot of treatments with the with what I think is a great product for that area, which is the Juvalook, and we're going to start using the Juvasonic device on those areas. I was thinking about doing a split face, but I think if you're going to get better results, I'm not sure patients don't want one eye to look better than the other. So we'll probably just use it on both eyes. But that's the next stage of where we're going with the Juvasonic device. I think that's going to be a really good addition.
Tom, you've taken what we initially created to solve a problem, a filler nodule, and you've turned it into an opportunity to improve aesthetic outcomes. And for that, I'm very grateful. And the idea of getting sort of a glass skin or a broader benefit from the injected product makes tremendous sense to me. So super exciting.
Excellent.
Sarah, we have 15 minutes left. If there are any questions, we can continue to go forward.
Yeah. If anyone has any questions, please go to the Q&A And go ahead and list them there. Right now, we do not have any other questions, but that's always a good sign too. You're explaining very, very well, Dr. Tom. Lots of valuable information.
I don't know, Dr. Tom, in Australia, if you're using platelet-rich fibrin, but my understanding is that platelet-rich fibrin, because it's coagulating into a fibrin mesh, can also be a bit uneven or lumpy. Maybe Juvasonic could address some issues with platelet-rich fibrin. And, in the US, we're hearing more and more of similar sorts of things with PDGF. So I don't know what your thoughts are.
Yeah, I haven't gone down the path of fibrin or the PDGF. We in Australia, I'm sure this is worldwide. We talk about platelet-rich plasma (PRP), and as you know, Sanjay, just like as in the exosome range, there's lots of different qualities of these products. And I have to say, my initial treatment of patients, particularly with hair loss with PRP and needing to inject it, we had sort of hit and miss results. I think that we weren't always getting great results. Now, whether that was because the quality of the PRP may not have been great, or whether that it doesn't work as well as the exosomes, I just found that I wasn't a huge fan of PRP. I know that that's not a very kind statement to make about PRP, because I know there are good quality PRP products out there and the fibrin products out there, but we've just not done a lot of that in our practice, especially since we've come across the Juvasonic. We now use the exosomes for our hair growth. And look, injecting platelet-rich plasma into the scalp is very painful. You've got to really love your results and be very, very enthusiastic that they're going to work to keep doing it, because I don't think I could sit there and let someone inject needles into my scalp, and lots of needles. It's very painful, very, very painful.
I would say about PRP, the problem is you start with something that's highly variable, and then it continues to get variable all the way through to the point of injection. So a normal platelet count in whole blood is between 150,000 and 450,000 platelets per microliter. Then the
Yes,
kit that they use may or may not concentrate it. Some kits use a single spin, a double spin. Most kits in the United States use a thixotropic gel that really produces a platelet neutral plasma, about 1 times baseline. So you're not even injecting platelet rich plasma. So all that variability, not to mention the injection technique and how much it hurts, creates for a lot of issues that you don't get with an off the shelf product like exosomes.
yeah, it makes total sense, and that's why I think there are a lot of companies out there who try and maximize the platelet factor numbers and so on and so forth. And I've seen a couple that I think could be really, really good, but I've just stayed away from that area, just because I'm really happy with what we're able to do with Juvasonic and exosomes. And I think once you find something that patients have a very high satisfaction rate, and it's not painful, and you get a result which you believe is better than what you used previously, you just won't go back to that previous treatment. And that's how I feel about it. I've
I
actually got
agree.
one more thought, sorry, actually, Sanjay, about that. There are a couple of companies that I've been talking with about platelet-rich plasma, and some of the companies who are developing autologous exosomes through the platelet-rich plasma, right? And because they're very thin particles, like the nanoparticles of the exosomes, that is one area I'm actually looking at to use the Juvasonic device to deliver those autologous exosomes from platelet-rich plasma, and so again being painless. So if we can find something that works like that, that might be another avenue for treating hair loss.
Yeah, so I'm a big fan of autologous products. I've been involved in PRP for 15 years, and I agree with you that autologous exosomes that are platelet derived may have some value. Certainly, with the regulatory environment in the United States, the FDA has exempted PRP for injection because it's an autologous blood product. So there is some advantage there, but I will leave you with a bit of a caution. And I don't mean to slight the product from Rion Aesthetics plated, but if you look at the secretome profile of platelets through evolution and God, they're designed to do two things. One is something around coagulation, and the second is something around inflammation. Those are really hardly the signals for regeneration. So I don't view that platelet derived exosomes are likely to be as good as umbilical cord MSCs, and there's some limitation with that from a scientific perspective, in my personal opinion.
Fair enough. All good points, actually.
Yeah. Sarah, any other questions? And if not, I think we can end even a couple minutes early and go to the draw. This has been a great conversation with you, Dr. Tom. And every time I see you, I enjoy our interactions and I learn something. So thank you very much.
Thank you, Sanjay. It's a pleasure. Thank you very much for having me on today.
So we have a question from, forgive me if I say the name wrong, Sue Keat Lin. And she says, Dr. Tom, have you used a product called Sunicos under the eyes, followed by Juvasonic, flat tip?
Sure, Sukut, nice to meet you, Dr. Lim. Nice to see you, Dr. Lim. I know Dr. Lim. He's a colleague of mine. No, this is interesting. This is very good question, Sukut. I'll tell you why. I've now been approached by Sunicos. We're having chats about me using their product under the eye with the Juvasonic device. So yes, I'm about to start a study on that. So Sukit, stay tuned. I'll hopefully have some information to you.
Perfect. And one more question. Have you done any studies using exosomes for skin rejuvenation with microneedling versus Juvasonic?
Yes,
Just
good.
wondering.
Another good question. Okay. It's funny because they're all the things we're doing, Sarah. We actually, right now, as I speak, we're using the Juvasonic device and separately microneedling, and we're using that on facial patients. Now, we're using a whole bunch of different types of exosomes. The reason why I didn't present exosomes for facial stuff is because it is a lot more difficult to see the facial improvement of skin with exosomes than it is to see whether someone's growing hair or not. Clinically, it's a lot more difficult to see. The patients, we have actually treated 40 patients at the moment with age 0 exosomes again on their face. And we found that more than half the patients loved their results. But when we used our skin analyzers and photography, it was very hard to see a difference because you're improving skin quality and it's regenerative. So it's one of those things that I've not been able to show that clinically what a great result it is. But there's one area that I've been very, very impressed with, and this is really important, Sanjay, which we didn't talk about today, is patients who've had allergic type, contact type irritant dermatitis or rosacea or any sort of inflammation of their skin, of their face. When those patients have a pathological condition, and we've been using the Juvasonic device with the age 0 exosomes over those areas, it's amazing within the 1 day the redness comes out. It's like you've used the most potent steroid and reduced that inflammation. The anti-inflammatory effects of the exosomes have been incredible. I know we're running a little bit over time, but let me tell you a little anecdote about what I did. I basically went and bought a cheap, and I shouldn't not criticizing, kind of cheap Asian microneedling device to just trial on the back of my hand. Like I like buying things and seeing whether these cheaper versions are doing anything. So I actually use this microneedling device on the back of my hand at a very low 0.5 millimeter just to see what it would be like. And within a day, I started getting this terrible itch on the back of my left hand. And I realized that the parts from the actual needles, they probably weren't stainless steel. I don't know what they were, but I have a feeling there might have been some nickel in there because I have a sensitivity to nickel. And I started getting this terrible irritant dermatitis on the back of my hand. And for 4 to 5 weeks, I was scratching daily. And I got to the stage where I actually made my back of my hand bleed. It was excoriated. And I was thinking, wow, how am I going to get rid of this? I was ready to go and prescribe myself some topical steroids and do some other things. And I thought, hang on a sec. I've got the Juvasonic device. I've got the age 0 exosomes. Let me go and apply this to the back of my hand. I'd been scratching for 4 to 5 weeks. I did this one treatment. Within 15 minutes, Sanjay, my hand, the itch had disappeared. And then I thought, oh, this is a placebo effect, Tom. It's not going to work that quickly, right? And then the itch started to come back slightly. And then about an hour later, it completely disappeared and it never came back. And so since then, every patient who I have who has some really irritant type dermatitis issues with their face, we just get the Juvasonic out, put the age 0 exosomes over, and they all rave about the next day. It feels fantastic. So I think these things work way better when there's inflammation because that's what they work on. When you have nice, healthy skin, the regenerative effects may take longer to see, whether you're using microneedling or using the Juvasonic. So people will tell you their skin looks and feels better, but you may not be able to see it with your eyes, especially when you're coming from a good place and you've got a good quality skin. It's not going to be as obvious.
Absolutely. Thank you so much, Dr. Tom. Okay, so we're going to go ahead and announce our winners. But first, we'd like to offer all of our viewers today a 24-hour discount code to purchase a Juvasonic device. Of course, if you were invited here by someone, by a sales rep, please reach out to them if you're interested in purchasing one. But for anyone who does not, you could use the code webinar 10 at checkout on our juvasonic.com website. You could also put, if anyone's referred you, you could also put their name there as well. And if you're in Australia, please reach out to Fresh Look or Look Fresh.
In actual fact, Enesi, just punch in Enesi, Enesi, enesi.com.au, and they'll find me. But you'll all should have our issues. Now, I have a little problem with picking the winner right now because I have all the US winners and all the Australian winners on my list here, and I can't tell who's who. And I don't want to make it look like I've rigged it and picked Dr. Lim. I'm sorry, Dr. Lim, it won't be you because it sounds like we have rigged this. But I might just get my nurses later to actually scroll through the list and pick someone, and I'll announce it. I'll announce it through you, Sarah, if that's okay, if you do an email out to people.
Or I could pick someone I can
Why
see.
don't you go for it? Go for it.
Yeah.
I'd love you to do it right now.
To make it fair, I'm only looking at email addresses, so no names, and I do see the AU at the end. So let me find the first one I see with the
And
AU.
Sarah, I ask that you look for a business professional email address as opposed to a Gmail or AOL or something like that. If you see one with an AU, that would be amazing. A .au.
There were a lot of .aus actually, Sanjay.
Oh, good. Yeah, you have a big following, Tom. Thank you.
Thank you, Sanjay.
Oh, perfect. Here's one right here. It's a Dr. Ben aesthetics.com.au.
You just
Perfect.
won a Juvasonic.
Dr.
Yeah,
Ben, if you reach out to me at Dr. Tom at Enesi, Enesi, Dr. Tom at enesi.com.au, we'll get that device to you. I hope you want it. I hope you get to use it and you love it like I do.
By the way, hi, Jamie Turjan. I see your comment about stretch marks. I think that's a really big problem and one that's not easy to treat. And Tom, maybe you can help us find solutions for stretch marks with Juvasonic and Age Zero.
Yeah, I think stretch marks are going to be always the bane of everyone's existence. I'm not really convinced that anything will work for those.
Yeah. And then for our US winner, we have D. Visnes at skinspirit.com. We know.
Awesome.
Yay.
Congratulations.
Dr. Vistenis,
Congrats,
pleasure.
Dr. Dean. All right.
And Dr. Dean actually asked a question. Sorry, I see that now. He asked, congratulations, Dr. Dean. He asked if any of the patients in the three groups were also treated with home daily topicals or oral hair growth supplements. And the answer was no. It was just the exosomes, just the Juvasonic, just microneedling. So the answer was no.
Perfect. All right. Well, thank you so much, Dr. Tom, for your time and waking up early for us. We do truly appreciate it. Um, but have a good night, everyone.
Thank you very
Thank you,
much.
everyone.
Thank you
Thank
all.
you, everyone.